歡迎大家嚟到今日嘅簡報會台。
Welcome to the press briefing. On stage, we have Dr. Chang Chuk Chuan, Head of Communicable Disease Branch Center for Health Protection, as well as Dr. Larry Lee, Chief Manager from Housing Hospital Authority. Dr. Zhang will give us an update of the latest situation. Good afternoon. We had 24 confirmed cases as of last night, and the numbers are from 13110 to 13125. 18 are local cases, 6 imported. Among the 18 local cases, there are 2 unlinked cases. 13103, a 24-year-old male living in Changsha Wan, Changyan House. Another one is case 13107, a 37-year-old living in Chunwan, New Haven, Block 1. There are 5 cases carrying L452R, suspected to be Delta variant. 13120. On the 11th of January, the case went to buy a hamster at Little Boss Causeway Bay. The case was sent to the quarantine center, and she's confirmed there. And 13104. On the 4th of January, the case bought a hamster at Little Boss Mongkok. The case has been tested positive. 13118 and 13123. On the 8th of January, the case a family member of 13059 who went to bought a hamster at Little Boss Causeway Bay, and also the same for 13120 and 13110. A family member of 13059, they ate at Dragon Place, Aberdeen. We checked the Leave Home Safe app, and they appeared at the restaurant at the same time on a particular day. But we've checked the plan of the restaurant. They were seated quite far apart. Case 13110. One was seated at table 13 and the other 123. They were quite far apart. They were there from 1-ish p.m. to 2-ish, and one from around 1 to 3 p.m. Both are male. They both could recall using the washroom at some stage, and our colleagues will go with people from EMSD to check the restaurant. Perhaps the infection took place in the washroom, but we'll have to see. The staff of the restaurant have to be under quarantine, and the restaurant should suspend operation for 14 days for thorough cleansing. So for regular customers of Dragon Palace, they should be tested to see whether there's been any infection or transmission within the restaurant. They all carry L452L, and some confirmed cases today are residents or visitors of Yak Kwai House. Most of them are suspected to be Omicron cases. 13104, 13113, 13116, 13117, and 13125. In total, including probable cases and people working there, there are about 20 cases who are either residents or visitors or people working at Yak Kwai House, including the one who has left for Shenzhen. So 12 floors totaling 13 units are involved, and they are of different orientations, 01, 04, 11, 14, 16, and 20, 25. There are about 9 orientations There are also preliminary positive cases. Case 13117, or rather, there's a preliminary positive case who is a security guard, and there is another preliminary positive case who is a security guard working in Kwai Chung Estate, and he may be a replacement worker on different floors. Another one who lives in Ying Kwai House is a cleaner of Yak Kwai House, and the case empties the refuse bins there. So the case works in Yak Kwai House and lives in Ying Kwai House. We have got a preliminary positive case, a 2-year-old kid who lives on the same floor of this cleaner, although they are not adjacent to one another. We of the view that residents of Ying Kwai House should be subject to compulsory testing. The preliminary positive cases, we have got about over 20 of them. About 10, as I said, are linked with Yak Kwai House. They are preliminary positive cases covering visitors and people working there. We've got a few cases linked to 2 students of Buddhist Fat Home Memorial School. They are fellow students, some of the same class and some not, and we are still investigating. Some students may have to be subject to quarantine. There is probably some transmission within the school. Among the preliminary positive cases, we have got one unlinked case living in number 35 of Nam Chang Street, a construction site worker, a 40-year-old man. He works. Sometimes he works in Chengshan Estate of Kwai Chung, working together with 6 workers who have to be under quarantine, and previously also worked at a swimming pool of Tin Shui Wai. He's subject to compulsory testing, and also he started to have a fever on the 20th of January. He's been admitted, and he has a preliminary positive case. We have to check the genome sequencing to see whether he's linked to those who have worked or stayed at Nam Chang Street. That's all from me. Dr. Lee, please. The situation of HA. As at 9 a.m. today, in the past 24 hours, we have 29 reported cases. 21 patients have been discharged. In total, 12,514 patients have been discharged. We've got 333 stations being treated at North Lantau Hong Kong Infection Control Center, HA's Infection Control Center, and AWE community facilities, and also 2 public hospitals. They are all in stable condition. The HA will follow the government's arrangement. Starting from the 16th of February, we'll introduce this vaccine bubble for infection control. By then, all HA staff will have to show the record of COVID-19 vaccination in office premises, clinics, and wards, and all related premises. For all frontline officers who have regular contact with patients, they have to have 2 jabs of vaccines for at least 14 days, and other staff will have to have received at least 1 jab of vaccine. Now, this bubble vaccine doesn't apply to patients who come for medical treatment. All right, Q&A.
Any questions? Lady at the back to my right. Now TV, a couple of questions, if I may. Dragon Place, it seems that there is transmission in the toilet, how many people have to be quarantined, including the staff, and how many tables of patrons have been there? And for those patrons, are they exposed to any risk of infection? Now, for Little Boss, those patrons who have bought hamsters are now positive. Are there any other customers that have to be traced? Do you think that all staff members have to be quarantined? For Yet Quiet House, we've seen a growing number of cases. Isn't it right for all the residents to be tested? It seems that there are some signs of the infection being spread to other blocks. Is it the case that the security guards or the cleaners are moving to other blocks for work, and is there a high risk of other blocks being infected? And also the kindergarten teacher and also the Pakistani mother and son, she got infected at the tunnel or at the underpass near the MTR station. If the infection risk is so high, how do you think the residents should react to this? Do they have to wear 2 masks as a precaution? Dragon Place, we are ascertaining the situation at the moment. The waiters have attended to these patrons, so they are at a higher risk. For the patrons, it all depends on the situation on the ground before we can decide whether anyone is of a higher risk. But in any case, I urge the regular patrons of Dragon Place to go get tested so that we would identify any potential cases. As far as Little Boss is concerned, there are people who've been to different places or different shops to purchase hamsters. The number is not small. Now, for those who purchased hamsters after the 22nd of December, they should go get tested. For those who've been to these shops are where there were cases of infection or where there were positive environmental samples, they should also get tested so that we can ascertain the exact number. For shops with positive environmental samples, the staff members have to be quarantined. Turning now to Yet Quiet House, we're still finding out. There are so many cases there. And some of the staff members have been working elsewhere, but it doesn't mean that they're spreading the virus. So we have to look at the residents of other blocks to see whether there is any transmission there. But the key thing is to go get tested. The kindergarten teacher and the Delia Memorial School students, it wasn't so much a 9-second contact. From the CCTV footage, the students came out, and after 9 seconds, the teacher went in. So they might have brushed one another. And where did that happen and how long did that happen, we're not sure, because we're not sure about what happened inside the underpass. It may have happened outside the underpass, but we haven't quite found any situation where they dined together or where they conversed together. And that's the only scenario where there was a possibility. Next, please. The lady with the English question, please.
Some questions from rghk. The first one is why the authorities suspect the 2 Delta cases might be infected in the toilet of the Chinese restaurant instead of while eating. And also, the second question is, how would you assess the risk of an outbreak in the Kwai Chung estate as more cases are seen in different buildings? Is a nightly mandatory testing order for all estate residents necessary? Thank you.
We've seen the floor plan of the restaurant and know that the 2 tables where the 2 cases seated, they are quite far apart. So we need to go to the site to have a real investigation to see, site visit to see the ventilation and whether there may be other routes of transmission in the restaurant. From what we understand from the two cases, they both went to the toilet during they leave the table and went to the toilet. Other than that, they may not have face-to-face contact during that period. But of course, we have to understand the actual situation during the site visit we are conducting now. I think at least the Yak Kwai house, they have some transmission in that building. So we, for those with cases working or living, we will urge the residents to get tested to see the extent of the transmission. We cannot estimate the risk at the moment. Yeah.
下一題。
Next, please. A lady on the right, please. Oriental Daily. We understand the situation about Yak Kwai House. Do you think that this has to be put under lockdown like what happened in Jordan? It seems that the administration wanted to send the 1,400 residents to Penny's Bay or Silka Hotel. Did you have this plan? Why change your mind all of a sudden? Aren't you worried about the risk of transmission? Also, 13064. He's been to Kwai Chung to collect the junk items and he sold them in Peiho Street. Does it mean that those who've been to this Peiho Street market would be running some risk? Do you think that that person is causing any risk of infection where he lives? And what about the security guard and so on? And how many people are involved? Do you have any particular problems with contact tracing? Is there any particular risk of infection? Now, for the pet cluster, there are two additional cases. They've been to My Love Rabbit and Little Boss. Are they all pet owners? And what is the consignment of their pets? Are they from the same place, of same origin? They come from the same pet shop. What about other pet shops? Any other risk there? And there is also a 2-year-old child in Ying Kwai House. Has there been any contact with the neighbors? What about the family members? Were they infected? What is the CT value? And for the two untraceable cases, are they from the pet cluster? Or have they been involved in high-risk activities? Now, for the Nam Cheong Street, we have to make sure that all the residents marked in this area will have to be tested. We're worried about some cases arising from this. And there is an untraceable case who lives in Nam Cheong Street. Now, this is a preliminary positive case. And we have to find out how many cases are there. Little Boss and I Love Rabbit, they belong to the same group. As to the precise details of the consignments, I don't have the details here. As to the other shops, I don't have any information here. I think we have to probe further into this. Ying Kwai House, the little boy there, he lives in Luk Yong, Sun Chun, Luk Yong Estate. The grandmother is living in Ying Kwai House, and he would stay at Ying Kwai House from time to time. And at Yak Kwai House, there is a cleaner who got infected, and they are on the same floor, although they're not side by side. So we suspect that they may bump into one another, and there is such a risk there. But for this boy, he developed a fever, and he went to the hospital for testing, and the family members are close contacts to be quarantined. We'll look at the results.
Next. The one in white on the left-hand side. I'm from Dot News. Good afternoon. I've got two questions. Now, in the community, we have an outbreak, but we do not have enough quarantine facilities. Is this necessary to have universal testing of our citizens? Second, the question of human to animal to human transmission. I'd like to know how the Department of Health and AFCD should work together. Well, as regards what strategy to take, I think different government departments will have to consider together, and they will closely monitor the situation to consider latest strategies. As regards the question of animal to human transmission, I understand that many experts are advising us on that, and we will consider those views as a whole. The lady in the back row. I'm from HK01. Good afternoon. Regarding the situation at Yat Kwai House, the 79-year-old man, I'd like to know whether his genome sequencing result is out. Are you sure that the whole outbreak of the few houses in Kwai Chung Estate was caused by the husband of the Pakistani woman who went there to pick up junk? And then we're told that a 2-year-old kid is the case now. And I'd like to know what floor does it live together with the cleaner at Ying Kwai House. Regarding pets, now we understand that at least 4 environmental samples have been found positive from pet shops. I'd like to know the exact location where these samples were taken. I'd like to know whether any staff members and customers of these pet shops are now confirmed cases. I'd like to know whether genome sequencing of Little Boss Causeway Bay is the same as that of its typo warehouse. Are you talking about similar strains or different? And I'd like to know where the security guard lives. How many licensed security workers are there at Kwai Chung Estate? As I said yesterday, for the 19-year-old girl who is the earliest case, according to Polytechnic genome sequencing review, that is a BA.2 case, but we're not too sure whether it is related to another confirmed case, so we will have to wait until our whole genome sequencing results is available. It will be available soon. By then, we'll be able to know more. We have to wait for results of whole genome sequencing, including those done for residents or cases of Yat Kwai House, to confirm the source and route of transmission. Of course, the only possible link we can identify here is the husband of that woman. But can there be other routes or sources? We will have to continue to see. That cleaner lives on the 14th floor of Ying Kwai House. The positive samples were taken from cages. We took environmental samples. AFCD colleagues would take samples from animals. So our environmental samples were tested at our own laboratory. We found a few positive cases. And as for the results of animal samples, you have to direct the question to AFCD staff. Whole genome sequencing results pending. And so far, I haven't got the result. Another English question, please. The lady on the right.
Good afternoon from the SCMP. First question is about the encounter between the 26-year-old kindergarten teacher and the 2 infected children in Meifu MTR station. Is this still the only common place that they've been to? And if transmission did occur there, why haven't we seen any other transmission on public transportation where it's very crowded? Second question is about the 17-year-old student who lives in Kuntong, who's still untraceable. Is there any genetic sequencing linking him to someone else? And then I'd also want to ask the I Love Rabbit store in Mongkok, have there been any other cases there since only the customer has been confirmed? And thirdly, just the case 13045, which is the woman who returned from Pakistan, then tested positive on day 26. I was just wondering, because she stayed with the 8-year-old kid in the hotel room, and then the 8-year-old's family subsequently got infected. So do we know whether it's actually 13045 who infected the family in Chansawan, or is it the 8-year-old who did when she went back to the home?
Yeah.
And is the Omicron BA.2 variant more difficult to detect? Thanks.
For the encounter of the two students of Delia Memorial Broadway School and the kindergarten teacher, that we according to the CCTV, that we know that the two students came out 9 seconds later. The teacher went in the subway, so we do not know exactly how they come into together, either in the subway or outside the subway, and how long. But that's the only clue that we know, that they probably have encountered during that time, because according to their daily routine and all the other paths, they do not have other common places or time that they might have encountered each other. So we do not know the exact how the transmission occur. And it is possible there are other cases in the community that we have not discovered yet. For the 17-year-old boy, the whole genome sequencing by our laboratory is still pending. But according to the Poly University, it's a Delta strain, and it has some genetic difference with the little boy cells lady. So we still do not know how he got infected, possibly from another people. Because he did not have any exposure to pets or hamsters or pet shops. So for the I Love Rabbit Mongkok, we only have one case. We are urging the public to get tested so that we will know the exact extent of the transmission. And for the 13045, the girl who came back with her was also infected. So she's also a confirmed case in the, I forgot the case number. So it is very likely that the girl infected the family afterwards when she came back home.
Oh, because the girl was confirmed after her.
Yeah, because she has a very high CT value, so it is possible that she was infected a bit earlier or later. We need to follow up. Yeah.
下一題，左手邊。
Next, the lady on the left. I'm from Mingpao. I'd like to follow up on the situation at Yak Kwai House. Now, for the preliminary positive security guard, I'd like to know what houses at Kwai Ting Estate does he work in? And do you know whether he has ever contacted 13064? 13064 has been to the refuge rooms of Yak Kwai, Lok Kwai, and Ting Kwai houses. Why is there only an outbreak at Yak Kwai House? What are the reasons, and will residents from the other houses been already infected. Now, residents are free to go in and out of Yak Kwai House even though they haven't been tested. Would there be a risk? Can't you close or cordon off the block today? So, according to the government webpage, as at 9 a.m., there are still 2,294 places available for quarantine. So why can't residents from Yak Kwai House been quarantined? Assuming that all residents are to be quarantined, how many units will they take up? And as for the 2 cases associated with Dragon Place, I'd like to know how far their tables were apart. And regarding hamster cases, the genome sequencing of cases associated with the hamster cluster. I'd like to know whether they are identical with that of hamsters. What are the cases where you've already got the genome sequencing? Is it possible of animal to human transmission? Now, for the 23-year-old girl who lives in Shakip May Estate, I'd like to know which branch of Little Boss has she been to? Have you already found out the strain she's carrying? Now, there is an outbreak at Sam Shui Po. Do you think this case is related to Sam Shui Po or to that pet shop?
I can't quite remember some of the questions. 13064. What we know is it's been to some of the garbage rooms. There may be some conflicting accounts. So he said that sometimes he saw the door open, he just went in. And during the transmission period, we're not precisely sure where he's been. It may not be the case that he transmitted the virus directly to the block because it hasn't entered into the block himself. According to the information, he may have infected other residents or some people who are residents of Yak Kwai House or who are working at Yak Kwai House. And I mean, it so happened that it didn't happen to other blocks, but we'll have to ascertain the situation. As to the Yak Kwai House, my colleagues in other departments are having meetings at 6 o'clock. The secretary will be bringing the media up to date about the latest situation. Now, during the lockdown testing, there were 2,500 residents there. And at that time, the capacity of the quarantine center may not be sufficient to cope. As to Dragon Place, we'll have to find out how far apart in terms of meters, but from the layout plan, it is quite far apart. And we'll have to go down there and have a look again. As to the genome sequencing for hamsters and humans, we'll have to wait a bit. We haven't quite completed all the work for human beings. Speaker not coming through. The security guard who's preliminary positive, what we know is he's a substitute. He will be substituting those who are on leave. During the lockdown, he was at Yak Kwai House. We're still finding out. Speaker inaudible. Where does he live? Right. He lives in Oriental House, Chang'an Estate on Chengyi Island. There are a number of cases that are omitted to mention. 13112, 13122. That's the family members of the Mei Fu San Chun teacher. 13114 is the student of the Buddhist Fat Ho Memorial College. He's confirmed today. 13121 is a family member of the DLS student 13079 and 13108, a family member of 12944 and 12960. Next, please. Economic Times. Also on Yet Kwai House. Do we have any new confirmed cases from other units? And the construction workers, do you know whether he's suffering from Omicron or Delta? What is his travel history? Has he been vaccinated? And the Buddhist school, how many students have been confirmed? And what classes are they from? And how many students and how many teachers are have to be quarantined? Is there an outbreak at that school? When was the last day at school for the students? You're talking about the preliminary positive case, the construction worker, I think. He lives in number 35, Nam Cheong Street. He would eat with his colleagues. He would be going to and from work by motorcycle. On January 16, he was on leave. He went to Fa Yuen Street. But otherwise, he's working at those two construction sites. As to the Buddhist college, 3B, 4B, 2B, students from these classes are affected. There are no teachers who are affected. For the classes where there are cases of infection, they have to be quarantined. They will have mixed class lessons, and they will have to be quarantined. We're still counting the number. Normally, there are 20-odd students in a class. Speaker inaudible. We don't know yet because these are preliminary positive cases. We don't know until the cases are confirmed. It's been inoculated with 2 doses of BioNTech, CT value 21.7. There are 13 units affected. There are 2 visitors there, involving 12 floors. Speaker not coming through. Well, the whereabouts of the Yet Kwai House residents, there are so many details, and we will impose mandatory testing where necessary. So please take note of the notice. Any questions? Any further questions? TVB, Dragon Place. By your estimate, how many patrons are involved? The patrons eating at the same time, do you think they have to be sent to quarantine? How similar is it to the Moon Palace situation? Do you experience any difficulties contact tracing? We will have to conduct a site visit. From the layout plan, they are seated pretty far apart, further apart than the situation in Moon Palace. Now, the 2 patrons have been to the toilet where they probably met. And for Moon Palace, they didn't use the toilet. They didn't leave the tables. The paths are never crossed. And the situation is somewhat different. So we'll have to conduct a site visit before we can decide on whether the patrons will have to do certain things. But the most important thing is to get tested. Unless there are any further questions, that's it for today. Thank you all very much.